Dear citizens of Nagaland, good evening. Today, the Honorable Chief Minister of Nagaland, Shri Neiba, inaugurated the Biosafety Level BSL 3 laboratory at Naga Hospital Authority, Kohima, in the presence of his cabinet colleagues and honorable advisors. The Honorable Chief Minister felicited all stakeholders for the support provided in the completion of the laboratory and expressed optimism that this facility will go a long way in catering to the immediate requirement for COVID-19 testing besides research works. He called upon all to lend support to the personnel who are in the front line in combating COVID-19. The BSL-3 lab at Kohima is a specialized biocontainment lab appropriate for work involving microbes which can cause potentially lethal diseases and conforms to all prescribed safety protocol and measures. The special features of the lab include biosafety containment, unidirectional airflow, and safe waste disposal system. The approval of ICMR for initiating clinical specimens for COVID-19 was received on 14 May 2020. I would like to inform that the state government has extended the provision of payment of ex gratia amount of rupees 10 lakhs to any employee of the Nagaland state government suffering fatality due to COVID-19 while performing frontline duties to cover drivers, cleaners, sanitary workers, caterers, and all such personnel, all workers involved in the management of the quarantine centers in the state, as well as to any other non-government functionary involved in any other activities for combating COVID-19 under the district task force. I may also like to inform that the state government has decided to again provide an opportunity to the citizens of Nagaland stranded outside and desiring to return to voluntarily opt for staying back at their present place of residence by registering on the portal imstranded.nagaland.gov.in if not done earlier. Such persons who voluntarily opt to stay back will be provided a one-time assistance of rupees 10,000. Further, details regarding these will be shortly made available on the imstranded.nagaland.gov.in portal. I would like to inform that the government has decided that an amount of rupees 50 lakh out of the total allocation of rupees 1 crore 50 lakh per assembly constituency for local area development program, LADP funds, will be earmarked for implementation of projects for strengthening health infrastructure and quarantine facilities for COVID-19 and for certain activities under the agreed allied sectors. The upper ceiling of expenditure for quarantine facilities shall be rupees 10 lakhs, and for the agri-allied activities will be rupees 15 lakhs. The remaining balance out of rupees 50 lakhs shall be used for strengthening health infrastructure. The detailed guidelines in this regard shall be issued by Planning Department. I would also like to inform that the Shramik Special Train number 06194 departed from Chennai on 19 May 2020 at 23:30 hours is arriving Dimapur on 22nd May 2020 at 13:05 hours, carrying 1,325 passengers. The state government has decided to set up an institutional quarantine center for the stranded persons returning to Nagaland at the Special Economic Zone, Ganesh Nagar, Dimapur district. Further, it has been decided that the DIG training, Chumukidima, will be overall in charge of the quarantine center, and he will put in place for all arrangements, including fooding, basic amenities, and logistics in a quarantine center. There have been reports received of unwarranted directive being issued by certain individuals or organizations obstructing entry of persons returning to Nagaland from outside the state into their wards or colonies, even after completion of the stipulated quarantine period, or for home quarantining of the concerned persons as per the existing orders and guidelines of the government. In certain cases, undue obstructions are being created for the setting of quarantine centers by the government in wards or colonies. The state government has given instructions to the deputy commissioners for sensitizing the concerned individuals or organizations or colony authorities on such unwarranted actions which infringe on individual rights as well as in violation of government orders. Thereafter, immediate and effective penal action against any such individuals or organizations obstructing entry of persons to their colonies or wards, or for setting up of quarantine centers by the government under the Epidemic Diseases Act 1897 and the Disaster Management Act 2005 may be taken. As regard the testing of suspected samples, till date, a total of 1,001 samples have been sent for testing from the state. The results of 978 samples have been received and all are negative. The results for 23 samples are awaited. In addition, through the TrueNet testing machine, so far a total of 27 samples have been tested and all are negative. I conclude by requesting the support of one and all in our united fight against COVID-19. Thank you.